Well, there is no disputing that technology has changed our lives from home to the workplace.
But it's also increasingly key to saving them. In the new issue of Madison magazine out today, David Douglas takes a look at what's changing in hospital ERs.
I'll get some orders in, guys.
Kyle Martin can be tough to keep up with.
So she's actually pretty sick. Her heart rate's in the 190s.
Always on the move.
It can be pretty busy for sure.
The St. Mary's doctor led the hospital's effort to get ER patients seen faster, taking the average wait from 52 to 14 minutes.
It goes from nothing to everyone running around trying to do the best they can, keeping up with things.
Great clinical skills will always be tops, but new technologies are helping speed ER diagnoses and improve patient care.
So you're able to have the comparison films if there's an older film available.
And when Martin says film, he merely means image. X-rays are all digital now.
You can invert it, you can increase or decrease the light intensity so that you might see something you couldn't see on a plain film.
What's more, those files can be seen outside of St. Mary's by specialists at other sites, even looked over by a doctor from home. The technology is coupled with electronic medical records that link up all three Madison hospitals, thanks to Verona-based healthcare software giant Epic.
I had a patient that coded, that came in unresponsive and unable to offer any history. We were able to look immediately at their records and get a better understanding of what they had gone through.
And having a clear understanding was the idea behind the glide scope as well.
Then this is the tube that the patient would breathe through while they're on the ventilator then.
Intubations can be tricky, even critical.
Well, there's no room for error. You can't make a mistake with that.
Now, a tiny camera can show doctors the larynx up close. For years, they had to rely on a light and their own eyes.
I've had a number of difficult intubations that were successful ultimately because of the glide scope.
When the scary moments are over and patients are ready to go home, they no longer have to head to the drugstore.
You know, that late night window where there are a few 24-hour pharmacies, but they may not be, particularly convenient for the patient.
Right in the ER lobby is InstiMeds, a full-service kiosk available with most of the drugs doctors prescribe ER patients without the wait.
They can get it filled here and then head straight home, which obviously they've already had a long enough evening, so anything you can do to improve and shorten that is beneficial.
That was David Douglas reporting, and doctors tell David that as helpful as technology is, nothing will ever replace great clinical skills and a great nursing staff in the ER.
And you can read more about these changing technologies inside the January issue of Madison magazine, available now.
Actually on newsstands today.
On newsstands today.